Alrighty, so today on the Wellness Grow Show, I'm joined by Sam Hart, founder of Hathr AI, a company helping healthcare organizations from small practices to government agencies use AI tools safely without compromising on data privacy or compliance. Sam's work sits at the intersection of AI, security, and human care, empowering healthcare teams to focus on what they do best, serving patients. So we'll talk about how Hathr AI is helping smaller providers access secure AI tools, how they're navigating compliance in a rapidly changing space, and how privacy first innovation can actually accelerate growth in healthcare. So welcome, Sam.
Hey, thanks for having me on the show, Scott.
Absolutely, absolutely. Okay, so Sam, take us back to the early vision. So, what
Yeah.
problem in healthcare or AI did you see that made you start Hather AI?
Yeah, no, absolutely. So it was a challenge that I saw across AI tools. And honestly, it's kind of the same with pretty much anything digital or anything software based, but and it goes back to privacy and security. So there I used to work as a government contractor, and I had this issue where, I make these recommendations to the government. You see the huge possibility with this generated AI tools. And then just getting paid to go through their privacy and security agreements is brutal. But it was really powerful because you're like, oh, big tech is ripping everyone off because you are the product. Like free tiers don't come free. You are the product. And so that was a problem. One, just like from a user's perspective, I'm like, okay, like who has days just to sit around and read user agreements? Like, no one. And then if you're a little guy, or even a state government or local government or a healthcare provider, like who has the money to go to war with big tech? No one. Literally, the only ones that do is the federal government because they still reserve the right, to have courts that can enforce the law and a police that can physically make things happen for better or worse. And so I was like, why is this so hard for people to do? And then, doing the research, going and being an auditor, looking at it, you're like, it's actually not crazy. You just have to have the incentive, the wherewithal to know that you need to do it. And then you have to care to do it. So we're like, let's just build something that I can actually use in my day to day that's secure, private, and compliant. Because this data, whether it's HIPAA controlled data, whether it's sensitive federal data, whether it's PCI if in finance or a range of other these different colors of protected data, like they can't use AI because big tech and these smaller providers are just slushing your data all around and you're on the hook for it. And I was like, this feels wrong. So that's where it came from. It came from a need as someone who's dealing with sensitive data on a day to day and wanting to be better at work. Like, why wouldn't you? So anyway, that's where it started. And that's why we built Hather to check all those boxes of security, privacy, and compliance and get access to best in class AI.
Okay. All right. So you said that Hather AI exists to make AI safe, private, and compliant. What does that mean in practice for your more so, for your customers?
Totally. One of the problems we see on a regular basis is customers will see something when a product has just like HIPAA compliance slapped onto it. And you're like, well, that's what they said. Are they going to do anything? Like, are they going to sign a BAA? Like, is their back end actually provisioned appropriately? Do they know which guidelines they really need to follow? You know, like, are they going to provide you their system security plan? Are they going to do yada yada? And the answer is no, because most people don't know, don't care, or don't have the competency to even know to ask those questions. Um, so we just try and make it easy for customers. It's one of those where they show up and they're like, hey, we can't afford $400,000 to come up with our own crazy provision version of Copilot that still is affected with a range of security issues. We're just like, hey, 45 bucks, here you go. It's secure, private, compliant, but we checked all the boxes. We show you how we check the boxes. Here you go. But yeah, does that work? Does that kind of make sense?
I think so. Yeah. Yeah. So, I mean, how did your background in federal contracting and compliance shape the way you've built the company?
Oh, totally. It's just knowing kind of how, and this isn't an obtuse answer, but knowing how things work in the compliance space. And I say that because it's like you have a lot of software developers who don't understand security on a fundamental level. And then you have security people who understand security, but they maybe don't understand software development on a fundamental level. And it informed us because we're like, no, like, yes, there is no actual HIPAA certification. And you can go to Department of Health and Human Services website. They will say there is no official HIPAA certification. Now, the flip side of that is that there are certifications and controls associated with what actually that means, like to use HIPAA. So, like for instance, the National Institutes of Standards and Technology, they actually publish guidelines for actually how to maintain your data. And the federal government has other standards on how to manage sensitive data in controlled environments. So, like for instance, 800-53 is the gold standard for protecting data in the cloud and storing data in the cloud. NIST 800-171 alpha is how you provide or protect your data when you're working with other federal contractors. NIST 800-66 are all the controls associated with protecting data in a HIPAA environment. You talk to these companies that are HIPAA compliant, they don't even know that NIST exists half the time. You're like, geez, come on.
Mm.
And so it's like, you have to know one, the technical right things to do. Isolate your things, run private subnets, make sure you have the private clouds, separated, segregated, having accounts spread out and segregated so you can't just have an AI tool rip someone else's data. All of that. And then the compliance aspect, after you've done your homework, is documenting how you did your homework. And so that's where we come in because we understand, hey, the technical know-how, how to build great tech. And then also, hey, this is also when an auditor shows up, here's all how we did our homework. So you have to know how to do all three of those. And you have to have the incentives to know how to do it right. Otherwise, you're putting all your customers and yourself, frankly, at risk, which is a big no-no.
Yeah, scary too, though.
Yeah.
Can you share maybe an example of how Hathr AI is helping healthcare teams work smarter? Maybe one that,
Mhm.
say, even surprised you, or
Oh,
some
yeah.
examples around that?
No, totally. So we service a lot of different clients, everything from clinicians to mental health care professionals to disability or developmental disability services organizations like, the ARC and, different types of governments. And it's fascinating to see the flexibility that we built into the tool and how that allows teams, especially from a budget conscious perspective, expand their business, speed up their workflow in ways you wouldn't expect them to. So, like for instance, lab test work results. Like when you're a doctor with like 20 plus years of experience, it's really easy for a doctor to read through your blood test results and be like, okay, I see what's going on, blah, 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 blah. Now it's really time consuming for that doctor to then write you a patient letter that's thoughtful and that also takes an emotional toll. So that's like one way, like this nephrologist was using our tools essentially to automate all his patient note writing, his interpretations that he agreed with, but turn it into a nice narrative format in addition to the different tools. Or we have other ones who do it for billing and coding. Be like, hey, here's some medical records. Associate the different insurance codes with this record. Have it pull it out. Or you just have it do a summarization. Like the need for quality summarization with large files, whether it's or it's lawyers and their firms going through a medical record for a malpractice case or to understand what just went and happened with their client, or a doctor that's seeing patients and they're like, I need to understand this medical history so I don't miss something with this latest visit. It's
Mm.
surprising to
Like,
see
give me
the
a
range and
summary.
flexibility.
So
Yeah.
it's like pooling all the data and help giving a summarize just so they can show up and be more present and knowing. Okay, like they've
Mhm.
got that solid summary of whatever's going on, so they can really focus on the patient and
A
help
hundred
them out. And
percent.
yeah, and they've got hopefully everything there, so they're not sorting through and missing stuff. I like that. Okay,
Yeah.
okay.
It's the power of AI, I think, like just for like your general practitioners, be able to access the wealth of information that's out there. So turn data, tons and tons and tons of data, the useful information quickly. If I had to describe what it is, but if you can't, a lot of these other tools, what'll happen is they say redacting or blah, blah, blah. I'm like, if you redact, it doesn't actually really work well. So I'm like, probably not having it being redacted. You know what I mean? And it's just our tool is really cool because it's just letting people do what they can't do with anything else, which is have a flexible tool that's safe. You know what I
Yeah,
mean?
good,
It's
good.
funny.
Okay. So I know compliance can feel intimidating to small clinics and practitioners. How are
Yeah.
you making secure AI actually usable for them? And I know you've touched on some things. Maybe you could.
Yeah. Well, I mean, first of all, it's like you said, it is intimidating for everybody. Like, even if you know exactly what you're doing, it's like, I don't know. Did you ever like build stuff with some of your parents or with your parents like growing up, build a
Yeah.
deck or something like that? And it's like like my mom, she was a handier one, and no matter how many times she would do something, like it's just like any other skilled person. Like it can be daunting no matter what. So it's like, building a deck out back, like, yeah, like that's not,
Make sure you
even
got
if
your
you've done it,
foundation, a good
yeah, like
foundation first.
no matter how many times you've done it, like, it is an amount of work. So if you're an experienced practitioner just starting out, like it is daunting. So the way we help people out with that is one, getting them access to resources that they normally couldn't. So first of all, our tool is hosted entirely in AWS's GovCloud. So it's the same servers that the Department of Health and Human Services uses themselves.
Important.
So that's one thing. Commercial entities just cannot access this. We're also a certified federal, state, and local contractor. That's how we get access to these tools. We can bring them to the public, that government grade security. Next one is that expertise, right? So even if you have this GovCloud environment, do you know how to make it safe? You still have to build all the walls. So the outside is built. Now you need to build all the internal scaffolding, for lack of a better analogy, to make sure it is actually segmented, private, like secure and compliant with the different regulations, the different, NIST standards they just rattled off so that you're not, oh, we have this great thing, but then internally it's not compliant. So it's making sure that they have access to these tools. They can't just get on the regular market. Two, they can be rest assured it's appropriate. We provide our system security plan. We provide a BAA within 24 hours, like super fast. And we know like there's just no other option for healthcare tools. You know what I mean? Like some of these people are like, oh, you don't need a BAA with this. I'm like, that literally doesn't make sense. That's like one of the basics of having a legal agreement and having it being technically set up. Because some people think that if you click that magic box or sign that magical document, it reduces it, makes their whatever service they're using HIPAA compliant. No, it also has to be appropriately configured. And that's why, tools like Copilot or, these other ones, you can pay $200,000 to get access to it. And then you got to pay another $100,000 just to configure it appropriately. And then you get
Maintain it,
the
maybe.
option. Yeah. Well, yeah, that's a recurring cost.
Yeah.
And then you have to pay the wonderful, generous amount of X amount of dollars per seat on top of the 300 to 400K that you already spent. Like,
Right. They get you on
geez,
those
that's,
seats, don't they? I see a lot of
yeah.
software companies always like, "What? I just added 1 seat, I gotta pay this much?" Like,
Mhm.
"Whoa."
No,
And then you're
totally.
like, monthly, or annually, it's like, it's a lot. It's a lot to
Yeah.
absorb.
And
Mhm.
that's why we say it's like $45 a month for unlimited use, whether every single one of our tools are HIPAA compliant. And so
Right.
it's, just try and make it easy. So we have the web app, we have the API where you can build your own things. And then of course we also do um, integration services. Gosh, I think I'm dying, going down the wrong pipe. You know what I mean? It's just one of
Okay,
those where a lot of these developers, a lot of these other companies started out as software developers.
okay.
And they have a very tenuous grasp on what a secure application looks like. And they don't know
They miss so
even
many
what
things. Mm,
compliance is. Yeah, they just don't even know the right questions to ask, which I would say is normally like no harm, no foul. But it's not your data. It is, everyone else. And you have, in my opinion, you have a duty to keep your other people's stuff private, you know,
sure.
and compliant. And the law, the law makes you liable for it too. So
Yes, that's important. So you mentioned working with research and university partners. What are some of the most exciting or perhaps meaningful applications you've seen so far?
yeah. So I love the practical aspect, helping people like grow their businesses and make them more profitable. And like you said, like being able to push the envelope, push that spaghetti in different places is really cool. So like for instance, we're working with this company and they're an institute and they do longevity research. They're using our tool to do, frankly, a ton of large scale data processing and finding correlations in the data because there's just not that much research that's been done previously on longevity. Typically, it's about reducing morbidity rates. There's a lot of the push, and the world's done an amazing job. But now there's this inflection point, and you're seeing a lot of different companies starting to look towards, hey, how do we make lives longer and better versus like just keeping you from dying earlier? And so it's really cool to see them doing the research, find the correlation of the data, and then being able to go out and like publish by using our tool. And that's one aspect. There's another company we're working with. So, like, for instance, they're using our tool to help with like finding where you are in the world. So you open up your app, you see where you are in the world, and to see if you would qualify to go to which nearest hospitals around you. So, like, does your insurance cover, which ones in your area? And it's like, boop, 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 boop. Perfect. And then verify, your insurance with that. So, something that people couldn't really do before. And now
Mm,
we're helping them out. So, like, so it's amazing to take like all this data, translate it, and bring it over. Another one, and this is more on the practical side, is a company we built an integration for. It's we've automated their medical coding school for
okay.
insurance. Totally automated. They're going to have to hire 4 or 5 people by the end of the year. They're going to have to spend hundreds of thousands of dollars just to do this process. Right now, it's been running, I think now about 4 or 5 weeks, 0 errors, and they just have the same person who's doing medical coding as a part-time job just supervise this tool just to make sure, and I always recommend like have a human, watch your tools just like you should, like with
Mm,
any other process. But it's been able to took care of their entire backlog. They're primed to grow like 5 to 10x this year, and all for a fraction of what they would have paid, even their one employee, but frankly, like what they would have been paying for like 4 or 5, you know what I mean?
yeah,
So it's
it's
wild to
massive.
see that our
Yeah. Okay. What's a misconception you run into about AI in healthcare? And what's the reality you wish more leaders understood?
think it's like any other tool. I think the misconception is people think it's like pink fairy dust. You just sprinkle on something and it magically happens. Or like these articles where they're like, it's the death of software developers. I'm like, no, it's not. It's not. It's just like now you're really good ones. Now have more tools to expand out. So it's one of those, it's like you're building an AI tool, you need thoughtful, really good developers, just like you did before. It's just another tool in their arsenal. And an example of this, people talk about vibe coding new apps. Well, it was awesome. There was this, it was terrible. It was not awesome. It was terrible. But like, for instance, there's this vibe coded app. It was called T. And it was for women to talk frankly about people in their lives, or maybe, just gentlemen that, their impressions of them. Well, the app had been vibe coded, and the entire database for these people's driver's licenses to sign up, you're required to put in a driver's license. The entire thing was compromised. So everyone's driver's license, it was like hundreds of thousands of people were just, when they were just leaked, because the entire database, not even password protected, vibe coded, was just sitting outside their environment for anyone to hop in and look at it. And if you had a developer who understood anything, quality software development, security, privacy, and compliance, they would have not done that. And now
Yeah.
that's
Wow.
for an unregulated app. Now
So,
imagine healthcare. Yeah. So,
yeah.
the risks and the stakes with that, right? Like, hold on tight. So you still need that. You still need quality people. You still need to think about quality prompting, and you need to think about that it's another tool. It's not magical fairy dust.
It's there to assist you, help you out, maybe help you
Yeah.
do it in a shorter amount of time, better
Mhm.
quality.
Totally.
So, and that leads me to my next question. You've talked about AI not replacing humans, but freeing them up to focus on
Mhm.
what they're great at. So, how do you see that balance evolving in healthcare?
So I see it a bunch of different ways. So I see it like on the clinical side. Like, I think it's amazing to think about how much of a doctor or a physician or another caretaker's job is about all the squishy stuff. You can tell a patient that they, like a robot, that they need to do and be like, this is your medication. And it doesn't go great necessarily. It's like, hey, when you're giving someone a cancer diagnosis, you need to have empathy, right? You can't just say, sorry, you have liver cancer, you're going to die next month. Like, that does not It's not good, frankly. And
Yeah.
it's not what humans are good at. Humans are good at bringing that empathy and explaining, hey, here are your options. Here's what's going on. Here are the different things. So instead of having to go through and do the paperwork, do the things that take away from each position's core mission, what AI should be doing is the dumb, dangerous, stupid, for lack of a better word, tasks in your workflow that maybe they need to get done, but
They're
it
time
could be done
consuming, maybe
time
they're,
consuming.
yeah,
Yeah. They're
tedious
time
and,
consuming. They're tedious. Maybe the process could be better. That's great for a machine. But for those like interpersonal things, maybe thinking outside the box, AI tools
yeah.
can even help you with that. But at the end of the day, that pink squishy body, like we want to enable more people to be doing that.
Big squishy body. I love that.
Right? Pink squishy body doing pink
Yeah.
squishy things. It's good. And then let the machines do what machines are good at.
So I know you're passionate about helping smaller organizations compete with larger systems. What advantages do you think the smaller players have when they adopt tech like this?
Well, I think one, you can see like the direct correlation in your quality of life if you're doing it right, right? Like, let's say you're doing 5 million ARR in your practice or 5 million revenue in your practice, and you adopt an AI tool that costs $45 and and you can see 20% more patients with lower error rates. And you're like,
Massive.
oh, let's say, you see 20% more patients. That's another $1 million. Boom, 6 million in your pockets with better margins. It's meaningful. Like, and then again, maybe even with larger organizations, on the flip side, like that company I was telling you about where we automated their entire medical coding, like that was their big bottleneck. Now
Yeah.
there's going to be another bottleneck that's classic ops management. But right now they're going to be able to grow five to 10x more this year just because of that one challenge getting solved. It's wild, right? Like those are huge advantages. I think the bigger you get, it can be more obtuse um, in seeing your benefits, but also I think a lot of that goes into companies getting scared of failing. I think in the bigger organizations, it's easier to hide behind output. And I always tell people, I'm like, before we start any of our projects, if we're doing your enterprise consulting or doing, license or whatever, I'm like, I want to understand what are our key KPIs right now? What are our key performance indicators here? And what are the metrics we're going to measure? Because I want you to know, like, when you're, looking at your tool, I want to know where we are right now. And I want to
Yeah.
see where we're going to. Because I want you to know, like, these tools, if done right, will make a difference in your life and in your practice and in your organization. And there's a clear ROI there.
Yeah, absolutely. So you've got a background in service and leadership. How has that influenced the way you lead your company and your team today?
Being customer obsessed, right? So it's like, well, why are you doing this? I always tell people, I'm like, what are you doing? Are you here to make a buttload of money? Like, are you, here to, be a servant leader? Like, what motivates you when I'm talking to people? Or like, what are we trying to accomplish here? And
It's gonna
I
go a little
think
bit, couple layers deeper too, right?
totally. And I
Yeah, it's
think
like,
like understanding that also helps you,
mm,
frankly, like it feeds into that customer obsession because then you can really understand like, hey, where are you coming from? And what's the solution we're going to get to? So like, hey, like when you have a conversation with someone, I was like, what's the first problem we need to solve first to get
okay.
you the biggest return on investment? Like, are we going to work on profitability first? Are we going to work in growing your top line revenue? Do we need to free up some of your star players from a tedious task that's been sucking all their time? And you really want them to get after this other thing that they could crush it on? You know what I mean?
Uh,
Like, or do they want to automate more in their business because frankly, like if they're the owner, maybe they need to take a step back because they're doing
yeah,
something else in their life. You know what I mean? Or they're
sure.
preparing to sell. So there's a lot of stuff in that where it's like,
That's a big piece too. I mean, a couple things that stand out is just like somebody who's owner operator, you know, wearing many hats, and if you're able to come in and see and be able to reduce even that admin time. It's like if they're spending
mhm,
full day, or even potentially, on just the admin and catching up. And if you're able to, it's like, how about getting a lot of your time back? How about that? Like, how about
Yes.
maybe even taking an extra day off? Like,
Hmm.
that,
Right.
that's massive. Quality time at home
Totally.
is going to make you do better at work as well. So,
Hmm.
that whole, there's a lot of buzz around the burnout, burn in, and being able to like stay focused on your why and continue coming to work because you use a tool like what you have, and to be able to identify and increase profitability, but it's like also getting a lot of time back, right? That's massive.
Totally. I think it was really interesting. I was reading some different books and I've kind of latched onto this idea, but it's like the best antidote to burnout is progress. Like, do you feel like you're making progress? You know? And our tool is progress. It's one of those things where it's like we are making a measurable difference in your business. So,
Good. Okay.
yeah, because there's nothing more defeating than being like, I show up every day, I do the same thing, does it matter? And like when
Yeah.
you're shuffling paperwork, it's like, oh yeah, like I know I gotta do this, but it really sucks. Like really sucks. And
Your favorite part about the job, right?
woo, yeah, that's why you became a clinician, right?
Yeah, just to
100%.
sit in an office and going through paperwork.
Yeah,
So,
no, absolutely.
what does responsible growth mean to you when you're scaling a company?
Yeah. Well, I mean, I think first of all, it's like being a good person. I know that's so obtuse, but it goes back to like, and this is like a lot of what I learned in the military is like you don't cut corners. And because if you cut corners, you're going to hit that side of the table. You know what I mean? And it's not just
Um,
you, but it's all the other people that are relying on you to do this for them. So it's like the security and compliance. Like, yeah, we don't cut corners. There's a reason we're also like, we went through the pain of becoming a federal contractor. It's not, that's not easy. It's not fun.
yeah. Yeah.
But it's
But you
one of
did
those
it.
things.
Yeah.
But we did it because I was like, yeah, we could do this on a commercial cloud, maybe. And the commercial AI tools would only maybe see like all of it. But like maybe it's okay. Maybe someone says it's okay. I was like, no, guys, like we're doing this. It's going to be more expensive. It's going to be more of a pain. But guess what? We're going to be able to get it to our customers. Or, like we actually lost some work because we were like, they're like, well, we need this to be cheaper. And we're like, that's just not it's not going to be cheaper. Like
Okay.
we sell like for instance we do firm fixed price contracts. We're like this is how much it costs. Sorry, like it, if we did it cheaper, we would be lying to you and then bill you later. And the funny thing is, this company actually checked in with them, and this company said we build it for free, and guess what? They're going to pay more in the end than with us. When we're like, no, this is the price. So they just got locked into a contract. So it's one of those where it's like I've never been burned by doing the right thing. I've never been burned by making sure all the boxes are checked. This classic compliance stuff, like do the homework and show how you did your homework. You
Okay.
know, yeah,
Love
you'll
it,
never
man.
regret it, right?
Good, good. So, I mean, and looking ahead, right? 12 months, what's the next frontier of Hathr AI? What kind of partnerships or collaborators are you most excited about?
Yeah, so I'm excited about a bunch. So one, like our web app, we have some new things that are going to be coming out soon. So check in regularly or start your own account, at app.hathr.ai. And then also on the enterprise side, like I said, we released with some of our customers a medical coding tool. We're going to be looking in the future. Hey, how can we expand this to serve more customers? We do a range of different integrations, so whether it's with eClinical Works, Dr. Chrono, and also with Epic, some of the big ones. It's we're really looking forward to the next frontier of like, hey, here's your problem, here's how we fix it, and here's how you get your time back at a better margin. Because, and this is a crazy stat, the American Hospital Association said that 40% of your medical bill is due to overhead.
Yeah.
Just the people shuffling papers, doing the coding, doing like blah, 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 blah. 40% of your care bill was just because of admin. And that
Ouch.
seems wild. So anyway,
Yeah.
we're excited to work with people and expand some of those out. So we got some cool stuff coming down the pipe.
Excellent, excellent. And I know you've said these a couple times, but I just want to make sure you have this moment. But tell people how they can connect with you, follow your journey, reach out, all that good stuff.
Yeah. No, on LinkedIn, you can look for me. LinkedIn, you can search for Sam Hart and Hathr, Hathr. You'll find me in there. And same thing, Hathr.ai, Hathr.ai. And then check out our website. Feel free to reach out. A human, even though we are an AI company, a human does read every one of your emails.
Okay. Good.
A pink fleshy body doing pink fleshy body things. And we'll get back to you. Our org box is contact@Hathr.ai too. So excited to hear from folks.
Great. Thanks so much for this, Sam. I really appreciate your time. This has been great.
Thanks, Guy. You too. Thanks for inviting.
Thanks for tuning in to this episode of The Wellness Growth Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.